Thank you, Mr. Pakada, for our Chapter 4, Nursing Care Plan, Impaired Skin Integrity, for the assessment, subjective data. Maya't maya ako naghuhugas ng mga kamay kahit nakakaramdam ako ng humahapdi na, as verbalized by the client. Objective data, alteration in skin integrity with the presence of soreness, chafe, redness, and several open areas or ulcer. Vital signs taken as follows. Temperature is 37.2 degrees Celsius. Pulse rate, 75 beats per minute. Respiratory rate, 17 cycles per minute. And blood pressure of 110/70 mmHg. For the nursing diagnosis, impaired skin integrity related to repetitive behaviors such as hand washing, as evidenced by soreness, chafe, redness, and several open areas on the hand secondary to obsessive compulsive disorder. Able to engage measures on how to prevent further skin damage, and will experience on healing of skin lesions and regain skin integrity. For the planning, short term, after 6 hours of proper nursing interventions, the client will verbalize behaviors and techniques to prevent further skin or tissue breakdown. For the long term, after 4 to 6 days of proper nursing intervention, the patient will show improvement on damaged skin, as evidenced by minimized skin lesions and redness. For the nursing interventions, independent, established rapport to the client. Having a client with mental disorder, trust is needed to be able to cooperate well during the plan of care. Encourage the use of mild soap and hand creams, rationale, help to minimize the tissue trauma until other forms of therapy reduce damaging behavior. Assess the overall conditions of the skin, rationale. Normal skin condition differs among individuals. A healthy skin should have good turgor and have quickly capillary refill of 2 seconds or less. Assess the client's level of pain, rationale. Pain is part of the normal inflammatory process. The extent and depth of injury may affect pain sensations. Dressing. This prevents skin from harmful pathogens. Encourage adequate nutrition and hydration, rationale. Sufficient hydration and nutrition helps maintain skin turgor, moisture, and suppleness, which provide resilience to the damage. Educate the client and the guardian about the causes of pressure, rationale. This information can assist the patient or caregiver in finding methods to prevent the skin breakdown. And for the dependent, apply the topical medication or cream on the client's affected skin or as prescribed. Rationale, this will help the wounds heal by keeping out infections and keeping the wound clean and moist. Next, administer antibiotics as prescribed. Although the intravenous antibiotics may be indicated, wound infections may be managed well and more efficient with topical agents. For the evaluation, short term, after 6 hours of proper nursing interventions, the client was able to verbalize behaviors and techniques to prevent further skin breakdown. Long term, after 6 days of proper nursing interventions, the client shows improvement on damaged skins as evidenced by reduced skin lesions and redness. The goal was met. For the next nursing care plan, it will be discussed by Ms. Ramos.